Good morning, everyone. My name is Cornelia Stevens. I'm the Executive Director of Top A Learning Centers and have the privilege of serving as the chair of the Early Childhood Recommendations Panel. I'd like to welcome everybody that is viewing our live stream to our meeting this morning and give thanks and appreciation to all of our panel members who are volunteering their time to really help shape and provide recommendations for our state's early child care and education system. This is a remote meeting. Today's meetings materials are posted on the panel meetings website at kschildrenscabinet.org. Panel members, they will clearly identify themselves when they begin to speak. And so panel members, you can actually raise your hand, do the raise hands feature, just so that Lindsay and I have an idea of who would like to speak, if you like to make comment or ask questions, etc. For today's agenda, we will be approving the September agenda. We'll be approving the August meeting minutes that were sent out previously. We will have opportunities for people to speak if we have anybody that submitted comment or question or whatnot to Kansas Open Forum, and I don't believe we have anybody for today. We will get an update on the Kansas Early Childhood Needs Assessment. We will hear from KSDE on the Kansas Early Learning Standards revisions, and so that'll be interesting to see as well. Our All In for Kansas Kids tactic work groups will give reports so we can hear more about our first meeting and what happened as our work groups met for the first time this year. Panel members will have an opportunity to talk about bright spots that are happening within your organizations or within your communities. And so start thinking about things that you would like to share with everybody that is on the meeting today and or watching virtually. And then our meeting will end and we'll have an opportunity for work groups to break out and continue the good work that they're doing. So for our first item, we are going to approve our September agenda. So again, panel members, please remember to clearly identify yourself when making your first and second motions. And so the first is, may I have an motion to approve the September agenda?
Leanne Neal, I move approval of September agenda.
Perfect. May I have a second?
This is Natalie McLean. I'll second.
Thank you. All those in favor, thumbs up or say aye. Any opposed, same sign. Very good, very good. The August meeting minutes were sent out. Do we have any adjustments or revisions to the meeting minutes? If none, may I have a motion to approve the August minutes?
Tabitha Rossbroy, I move that we approve the minutes from August.
Perfect. And may I have a second, please?
This is Saldana Chestnut. I second.
Thank you. All those in favor, thumbs up or say aye. Very good. All opposed, same sign. I literally caught myself in a meeting, like face-to-face meeting, asking people for thumbs up for approval. And so it's just how this works now, right? And so perfect. So for our agenda for today, we do not have anybody that is slated to give a presentation to the panel, but please know that if anybody would like to actually come and present information to the panel, you can actually submit information there's an open forum comment form on the Kansas Children's Cabinet website, and please submit information by 5 o'clock the day preceding our next panel meeting. You have the opportunity to either share written comments or sign up to share verbal comments with the panel. We would love to be able to hear from you. If you have new information, just questions, comments, etc., we would love to give opportunities for you to come and share information with the panel. So for our today's agenda, we first have an update on the 2023 needs assessment. And so I'm anxious to see, as we're kind of looking at how things are. When we started the first needs assessment, it was from 19 through 22. And now we have our current needs assessment. So Chris Tilden will be giving the update for our needs assessment, current needs assessment work. And so I hand it over to you, Chris.
Thank you, Cornelia. Thanks to you all. I'm really excited to be here to talk a little bit about where we are with the needs assessment in 2023. So with that, just a little bit of background, which I think is probably necessary for all of you, but as Cornelia said, we've begun this process in order to build upon what we learned in 2019 when we completed our first early childhood needs assessment, and we have done annual updates each year. But this year we were fortunate to receive funding early in 2023 for a new one-year planning grant through the PDG Birth Through 5 program. So we are using support from that planning grant to conduct this new needs assessment. And we hope that this won't sit on a shelf. The goal here is to inform the development of a new early childhood system strategic plan. I see on your agenda, you have your groups that are meeting to talk about tactics, and the current strategic plan are going to be talking on the agenda later today. The goal is to look and see, okay, 4 or 5 years into this process, do we need to potentially realign strategies? Are we headed in the right direction? Is there anything new that we need to turn our attention to? So we're really excited to have this opportunity to develop a needs assessment and use that to inform our work going forward. And move to the next slide. Just a little bit of background on our approach. One of the things that I think we were really that in a significant way contributed to this work is that there has been a lot of evaluation of efforts and a number of reports, produced this year that we have been able to use and analyze and synthesize as part of this process. One of the goals that we had was not to do too many new surveys or new listening groups, because you all certainly know that we do an awful lot of surveying and an awful lot of focus groups and an awful lot of interviews. And one of our goals was to not come back to you and say, oh, by the way, can you add one more of these to your agenda? So we've been really fortunate. There has been a lot of really important work. This year alone, I can think of a number of initiatives. KDHE had 2 really large needs assessment. There was a new assessment completed of the McVie program, along with other Kansas home visiting programs. KDHE also oversaw development of an interim MCH needs assessment for the maternal and child health programs. Many of you probably participated in the Casito workforce development survey that was completed here fairly recently. There was a lot of work done on insight and input into career pathways. There were a number of reports that were produced talking about the impact of pandemic funding on our early childhood system. And we also in July submitted our year 3 PDG Birth to 5 report to the federal government, which kind of summarized the work over the last 3 years. So I'm sure you all could think of other studies, but I think there has been a lot done this year that we were able to build upon and utilize as part of this process. As is always the case, we also want to ensure that we're hearing from voices of diverse audiences from around the state, and that we've had a lot of opportunity also there to ensure that we're hearing from Kansans from all over the state. In late 2022 and early this year, there was a developmental health survey completed by over 1,500 Kansas parents and providers. And then this spring, there were, I believe, 6 engagement sessions with participation both from providers and families Those were conducted in both English and in Spanish, and received a lot of great input from families as part of that process. I mentioned the Casito Career Pathway Engagement Sessions. There have been numerous sessions this summer that have provided insight from the workforce in our early childhood system. We did talk with a number of childcare operators who closed during the pandemic, and some of those facilities have subsequently reopened and some have not. And we really felt like that provided some really important insight in terms of the impact of the pandemic, as well as how some of the supports and resources that were made available to those centers and to those homes, what kind of impact did that have on their operations? Many of you, I'm sure, participated in the Early Childhood Transition Task Force Tour that also wrapped up recently, which had over 500 participants from around the state participating in those, I think, 9 sessions. And we've continued to collect stories through our Tomorrow's Story Bank. So we've had a lot of different opportunities for perspective from families, from providers, from the workforce, people who are impacted by the system. So what we have been doing for the last month or so is looking at all of that quantitative and qualitative data and synthesizing that as we develop initial findings for this new needs assessment. Just a few words about how we hope to frame the work as we move forward. Certainly, we're not abandoning the work that's been done so far. And so as we thought about the issues that we wanted to assess, we're certainly looking at the goals that were developed for the initial All In for Kansas Kids strategic plan. And you all probably can recite these, so I don't know if I need to read through the list, but certainly there's a lot of emphasis on how we enhance collaboration and coordination at all levels around the state, how we ensure that families have knowledge and choice, a lot of emphasis on capacity of our workforce, of our environments, of the various programs that we serve. Next slide, please. We also wanted to make sure that we were asking questions about key findings from the needs assessment in 2019 that I think if you go back and read through each of the updates, we continue to recognize that there are issues that that are longstanding and that we still need to address. And there were really 3 that stood out as we've done this work. And one is the recognition that there are financial and geographical disparities in access and availability of services to the families who have young children in the state. Particularly families have been struggling with access to affordable childcare. And we also know from a systematic perspective that it's not just families that are struggling, it's providers, including the early childhood workforce, that we recognize are stressed. I mean, we have a business model where families can't afford care, and yet providers can't afford to pay the type of adequate wages that are necessary to attract and retain a high quality workforce. And as I noted, we talked with a number of centers that have closed, some of whom have not reopened. Some centers around the state have simply not been able under this business model to continue their operations. So we want to see what we can do to address those concerns. So I'm going to go through a couple of slides and I'm going to use the framework of our goals in the current strategic plan to talk about this work and to ask questions about, and please certainly feel free if you have observations. I'm going to leave a little time for question and discussion at the end, but if anyone has questions of clarification or insights you want to share, feel free to do that. Our first goal is in the strategic plan was really built around collaboration and coordination. Are we enhancing coordination at the state level? What are we doing to improve collaboration among local partners? Are we bringing the right public, and particularly are we attracting private partners into this discussion about how we improve the system? I certainly think that we would all recognize that the state directors team and the other governance groups that are part of our system, including you all as representatives of the panel, have been involved in a lot of various initiatives over the last couple of years. And I've provided simply a handful of examples here. If you look at the work done to enhance 1-800-Children, the creation of the data trust, the development of the common app that's been used for a lot of the grant programs administered through the state and the agencies that are part of the system, the development of tools like the career pathway, the workforce registry. There are a lot of significant efforts happening. And again, this is just a handful of examples. We recently have utilized some network analysis tools to work with the local interagency coordinating councils, which, as you know, oversee the Part C programs, but represent early childhood providers across the state. We've worked with over a dozen of the LICC. And one of the things that we have seen is that there's been significant growth in the size and the work being done through those organizations. And so we're really heartened by the collaboration happening at a local level as reflected in the analysis that we've done with those groups recently. And I think it is important to recognize that there are a lot of private partners, not just state agencies that are engaged in this work. And again, I highlighted a couple. There's particularly with pandemic response, a lot of work being done with Child Care Aware of Kansas, the Kansas Children's Service League, and also other government agencies. I highlighted here Department of Commerce that's been very involved in some of the early childhood work as of late. I would also note that the Department of Corrections was an agency that was included in the data trust. So both from a perspective of private partners and some new kind of public partners, we've seen a lot of growth over the last couple of years. At the same point in time, while we have seen a lot of growth, I think it is important to recognize that there is acknowledgement that there are still a lot of inefficiencies associated with the coordinated multi-agency model that we utilize to oversee our early childhood system. And unfortunately, on account of that, the Bipartisan Policy Center did a nationwide scan looking at programs and literally has said Kansas is next to last in terms of the efficiency in our system. So despite all of these really positive efforts over the last couple of years, we certainly recognize that there are ways to improve the efficiency and effectiveness of the system. And I think that was acknowledged in Governor Kelly's executive order, the first executive order of 2023, which, as you all know, established the Early Childhood Task Force that is looking to make recommendations for a new approach to governance of early childhood in the state. Next slide. In terms of parent information and choice, would we say that families have better information and choice given the work of the last couple of years? Again, I earlier highlighted the fact that we've done a lot of work with 1-800-Children. And if you look at the trajectory of utilization of 1-800-Children from 2019 to 2020 up to 2022, there has been significant growth in utilization each and every year. So that certainly has been a bright spot. There have been a number of pilot projects, only one of which I'll cite here, looking at improving the information that families have and connecting them with resources. One of them is the Bridges pilot. I don't know how many of you are familiar with that effort, but it grew out of recognition that many of the children with developmental delays or developmental disabilities being served by the Part C program, which serves children from birth to age 3, there were a lot of those children who were not being connected to resources when they graduated from the program at age 3. And so KDHE had developed a pilot program to ensure that the children and families at the age of 3 were being connected with other resources if needed after they ended their participation in Part C program. There were 4 pilot communities that participated in that program, and they've seen enough success that now KDHE has integrated that program into their ongoing standard maternal and child health program and are looking to expand that to other communities in the state. Another area where we know we've been concentrating a lot of effort is in the Ages and Stages questionnaire. And it very much like 800 children, if you look at the utilization, the screening that we're doing, we're seeing considerable increase in the number of children being screened, and that's certainly a positive as well. You know, with all of that, you know, the pluses associated with that, I think we're still seeing some of the same kind of issues at play. And that is, we certainly have data that suggests that despite our progress, there are still significant disparities in terms of parent access to information, and the availability and accessibility of services. We're still seeing disparities based on where you live in the state, whether you live in a rural or an urban area. And particularly impacted are many of those living in low-income communities. If you look at the survey work that we've done or the parent engagement that we've had in recent months, there still is a fair amount of frustration expressed by parents about their lack of the information. You know, there were a lot of parents, for instance, that participated in the developmental health survey and focus groups, and they said, you know, I see my child being screened more often. What I'm not getting is information about what that means, and whether or not my child needs to be connected to other resources. We're still seeing a lot of that kind of what I think the way we characterized it in 2019 is we said a lot of families are being forced to connect the dots on their own. And we still see that in a lot of the discussions we're having with families. We also see that in Kansas, there are, compared to many, many other states, Kansas oftentimes ranks near the bottom in terms of utilization of some of our benefit programs. We still have pretty low utilization of things like the TANF program and the SNAP program, which suggests that, again, we're not effectively linking enough families that could benefit from those resources. And as I noted in the first slide above, there are certainly disparities in terms of access. And one of the things I would point out in the Kansas Kids Are Good for Business survey, There was also a finding that in terms of worksite conditions that support healthy families, things like subsidized childcare, access to on-site childcare, infant at work support policies and resources. That study, which was conducted by one of the epidemiologists at KDHE, suggested that there are also racial and ethnic disparities in terms of access to those worksite resources. Next slide. In terms of workforce, we certainly, an important question is knowing, is our system supporting a trained and well-compensated and resilient workforce? One, I think, bright spot this year was that for the first time in several years, between 2022 and 2023, the number of child care workers in licensed facilities actually did grow this last year, certainly a bright spot. And we are now at numbers that are slightly above where we were pre-pandemic. So that's a real positive. The Casito Workforce Survey initial results also said that overall, providers indicated that they feel relatively strong about where they are in their career, their social and emotional health, and financial stability. And we've made some significant progress, as you all know, on some systems that we think are really important to supporting the workforce in the state, namely the career pathway, the workforce registry. Plans are underway and implementation processes are in place so that in the fall of this year, we'll see significant new progress on those systems. Next slide. You're probably seeing this pattern, and that's kind of the good news, bad news, because in all of these areas, I think we're making progress, but we still recognize there's work to be done. And in terms of workforce, I noted that overall in the Casito Workforce Survey, the majority of respondents said, I feel good about where I am in my career. I feel good about the resources that I have. But at the same time, there are still approximately 1/3 of providers who completed this survey that simply said, given my salary, I do not have sufficient money to even buy the basic things that I need on a day-to-day basis. We also continue to hear from programs that there are significant staffing challenges. I mentioned the interim MCH program needs assessment that we completed earlier this year. And half of the respondents to that survey said at this point they felt like their programs were not adequately staffed. And I threw in a quote from one of a recent discussion with a provider, which I think kind of summarizes where we are. And that provider said, it's hard to recruit teachers on what childcare pays, especially after the stress of the pandemic. So we still know we have progress that's necessary as we work to build a stronger model. How are we doing in terms of increasing access to quality services and appropriate learning environments? I think we would all recognize that we've invested a lot of important dollars in this work. Over the last 3 years alone, we have invested over $8 million through subgrants in local efforts to train workforce, equip facilities, ensure high quality services for children and families are available. And there's certainly some bright spots in terms of in terms of those local efforts. I wish I had more time to go into some of the some of the success stories that we've heard, and perhaps we can do that at a later time, but I know I'm limited on time today. I think it's also important to cite links to quality, that they have been working hard to develop new standards of quality and are providing a real wealth of resources to support efforts of providers to build skills and resources and connections, and literally hundreds of providers around the state utilizing those resources. Next slide. I guess my first bullet here is a plus, but also one of those challenges, and that is it's really exciting that we now have this new resource through the Child Care Capacity Accelerator grants, and those grants alone are funding over $40 million to support capacity building in the system, which is great news. At the same time, if you look at the requests, those requests totaled $117 million. So it's great that we have resources like this new grant. It's also important to recognize there's a lot of unmet need within this particular program. About a third of the requested resources provided. And another point I thought it was important to look at was that there also not only is a gap between the resources that are available and the resources that are being used, but to some degree there's a gap in awareness of the resources. I thought it was really interesting in the Casita Workforce Survey that less than 4 in 10 childcare providers indicated that they were familiar with the early childhood core competencies. And an even smaller number, less than 1 in 5 providers, said that they were familiar with links to quality. So I think we have some real work to do, not only to enhance resources, but to ensure that we're creating sufficient awareness and knowledge of the resources that are available. In terms of capacity and access, at the end of the day, what we're trying to do is ensure that Kansas families have access to the needed services. And so how are we doing? We know that the pandemic had lasting effects on families around the state and many of our providers. At the same time, it is, I think, important to recognize that an awful lot of children were able to receive child care services through stabilization funding. That funding was over $300 million and estimated to have reached and supported over 100,000 Kansas children. So again, terribly important. And I mentioned earlier the 2022 to 2023 growth in the number of childcare providers and licensed facilities. We also had, again, for the first time in a number of years, an actual number of an increase in the number of licensed childcare programs in the state. The recent Child Care Aware 2023 supply demand report noted that there were 80 net growth of 80 programs between 2022 and 2023. So certainly some good news there. Next slide. In terms of some of the challenges that remain, while the number of total licensed facilities grew, one of the things that we have seen is that the number of licensed childcare homes actually continues to fall, and that number has literally fallen each year since 2019. So in 2019, we had 2,419 licensed childcare homes around the state. Again, that number's decreased a bit every year and stands at 1,904 in 2023. So despite the fact the number of facilities overall, including centers and others, has grown, with licensed childcare homes has been an area where we have struggled. We also still see that the estimated demand for childcare services, there is not a county in the state that isn't impacted, and we believe that demand currently exceeds capacity in all of the 105 counties around the state. And not only from a perspective of accessibility, but certainly we understand that childcare costs are a challenge for Kansas families. I think it's important to note that at this point, it still takes about 14% of a median couple's income to provide infant care in a center-based environment, and that for a median single parent, that literally is close to half, 45% of the median income. So affordability is still something certainly that we need to address. So I would summarize by saying, yeah, there are a lot of examples of progress. Kudos to you and your colleagues around the state who have done an awful lot of work over the last couple of years to make progress. I've provided some examples. I think one additional data point that I'll provide is that there was a number of tools that were used to look at the perspective of the participants in the Early Childhood Transition Task Force listening sessions around the state. And one of those was a hope meter, where people were asked on a scale from 0, having little hope, to 10, being really hopeful about the future. Where do people stand in terms of how they feel we are positioned in Kansas? And the average score among those close to 500 people that participated in that process was 7.42, well above the median. So that indicates that there's a strong amount of hope and positivity among providers, among parents who think we're well positioned for growth. We are certainly going to, the needs assessment won't simply be about gaps. I think it's really important that we acknowledge all of the accomplishments that have been made and that we can build upon. They are real strengths that we have to be able to continue work going forward. But we do have work going forward, and we hope that this needs assessment will inform the next strategic plan that we will likely launch this fall and into early next year. Next slide. All right. With that, I am going to pause, and I would love to hear some perspectives in terms of, based on your observations, what's happening in your communities. Do the bright spots, the things that we have highlighted, as well as some of the challenges, do those jive with your experiences? Are these general findings consistent? And is there anything, again, this was a high level summary, but is there anything that, as I went through kind of some of these high level findings, that you feel is missing, that we need to ensure we're incorporating into our analysis as we do this work? So I'll pause there and see if we've got any comments, and also certainly if you have any questions, I'd be happy to try to address those.
Tessia?
Okay. Yes. Kezia?
Good morning. I am a I'm a family child care provider in my home here in Manhattan. My question is, I know we had the grant, the $1,800 a month, but lately the grants have been going towards increasing centers. Is there something to help us increase our home businesses in that sense? Because that's our struggle as well, because the last couple of grants, they weren't even geared towards us because you have to have a center, you have to have working with the community, and that was for the Porter $250,000. Do you guys see anything in the future of guiding that towards home childcare providers who are, because some of us, like you said, the numbers went down when some of us are still struggling to keep our businesses open because parents can't afford it. So do you see anywhere or any of that coming towards us to increase our home value? I mean, our home business, because we can't get locations because of the pricing of locations and things like that.
Yeah, and I would open that up to others as well, because there are a lot of content experts sitting here on the panel. So, you know, as I noted, we recognize that that's a gap. That's an issue with those numbers continuing to fall. So certainly, I hope as we develop and publish a needs assessment that we will recognize that that's a challenge and that we need to be thinking about how to build resources to turn that trend around. But I'd certainly open that to others because I'm certainly not the content expert on work that's being done to address that particular challenge.
I can comment that, so I'm Cornelia Stevens, and I serve on the governor's Early Childhood Transitions Task Force. And I was at 8 of the 9 community engagement tours that happened across the state. And you are not the first to mention in terms of a home provider that things are difficult, for home-based providers, and that the cost of care, which you have to, there's reasons that it costs as it does. We have to, be able to make ends meet or whatever. The ends aren't meeting, as well as they need to, for those providers. And a lot of the home providers were voicing concerns that they would not be able to remain open if more support didn't come in. They did voice that it was nice to have the additional funds that came in during the, when we had the sustainability funds or whatnot, but those are gone. We're not, and what are we going to do to replace that? And so I do know that there is conversation at the state level on what we can do is there anything that can be done to kind of not necessarily mirror, the sustainability funds, but what more can we do in the state to be able to help home-based providers, in addition to centers, but specifically to home-based providers, because we have seen that number decrease across the state, as Chris mentioned, with the data. And so I don't have an answer. Maybe somebody else that's on the Zoom, this morning has more concrete answers. I can just let you know that there has been dialogue and there's awareness at the state level, and they're trying to figure out what resources they have to be able to do anything about it. So I do know that. But does anybody else have anything to provide as a response to her question before we get to other questions for Chris? Eldana or Amy, are either of you responding to her question, or do you have questions for Chris? Okay. Okay, I think that's all we got in terms of answers.
Well,
I'm sorry, yeah.
Yeah, and I guess I would just add to that. There's been an awful lot done. I mean, an awful lot of focus on, we've developed a cost of care model. I mentioned earlier the broken system. I think there's definitive recognition and a lot of work that has been done to recognize where are the gaps, what's driving the fact that we have this broken business model where, despite the challenges of affordability, we still can't afford to pay providers adequately and to even keep the doors open. So there has been a lot of analytic work done, models developed over the last couple of years and definitive recognition that that's an issue. So I think that is part of the work going forward. Part of the strategic planning process is to identify what are the tactics, what are the strategies that we need to address that. So I think there's significant recognition of the problem, and a real desire to look at solutions and strategies to address those problems.
Yep, agreed. Eldana.
Thank you. So Chris, first of all, I wanted to support what you said as far as example, and my responsibility is for Johnson, Miami, and Franklin counties. And we have definitely seen an increase in the number of applications. For example, and kind of because the home provider kind of goes to her point a little bit, in the past 3 months, we have had 14 new center applications. And most of these centers are for greater than 100 children. So the good and the bad, the good, yes, there's more opportunities. However, the challenge and what worries me the most is that twofold. A, where are they going to get the staff to staff these facilities? Because all of our currently open facilities are challenged to get qualified staff so that the kids can be there. Second of all, how are the parents going to pay for it? Because I don't think we've really addressed at all the challenge of affordable care. We're just making more access if we can find staff, but we haven't addressed the affordable care at all. And just a little bit to her point that, yes, we did have approximately 20 home applicants in that same time frame, but you're only looking at, at maximum 8 to 10 kids. So there's a major difference in the number of slots. So I just have the big concern that we really haven't hit the mark on addressing our affordability issues, and not for sure how much it's really going to help the parents.
And I would add, Eldana, in many, not that there are not challenges in urban places. You're citing the fact that there very much are. We also know there are disparities. A lot of our rural communities are communities that face some of the challenges associated with access, and I think that highlights even more the importance of thinking about how do we help resource family homes, because the large centers that you're talking about, simply aren't going to be a fit for most rural communities that don't have a population size to support many centers. So I think all of this information points to a recognition of a dire need that we are going to have to address in a significant way.
Amy.
Hi, I'm Amy Gottshammer. I just wanted to ask, Chris, you mentioned a list that we came in second to last in effectiveness.
Mm-hmm.
And I was wondering if you're aware, or anybody else on the panel, is there already a group that's focused on this and perhaps looking at what the states that are on the top of the list are doing and how we can make that work for us in Kansas?
Yeah, I think that's certainly one of the goals of the transition task force is to look at other states and look at those models and look at some of the interventions that are being deployed in other states that are doing this work really, really well, and looking to see, how, to what degree do those fit within, would those fit within Kansas? So I very much think that the work of the Early Childhood Transition Task Force is focused on not only understanding the dynamics in Kansas, but looking at some of those best practice models and how they may fit within our state. So I think that is a really important part of our work going forward.
That sounds
Correct.
great. So I just want to make sure somebody was doing it. So that sounds great.
Yes.
Thank you.
Yes, and to add that we've already had, we had both Missouri and Colorado come to a task force meeting to talk about how they created a more efficient model for early childhood programs in their states. So they came and presented to us so that we can kind of talk to like our neighboring states in terms of like what's happened, what did you do, and how effective was it, and did it benefit children, families, and community partners, that work within the state. And so we're definitely reaching out to people who have already done this work to not start from ground zero. If we have models that work that we think can fit into what we're trying to do in Kansas, then we certainly, would do that. And so, good question. Michelle.
Yes, I just wanted to mention, as we talked about the true cost of care and helping to support family child cares, I know it's just our subsidy program, but our child care assistance program in Kansas has significant changes that are coming starting in December of this year. So in a couple months, we completed the market rate survey, and that uses market rates, but we also had Simon Workman, who completed the Kansas cost model, do the narrow cost analysis to determine the cost of care to meet the health and safety requirements. And then he also looked at other quality markers. We're changing our child care subsidy rates to meet those markers, those higher cost of care markers, beginning in December. And that's part of what those payments, that $1,800 that went out, was to offset the cost of what our current subsidy rates are versus what the true cost of care is. And we have a new agreement, and we will be doing a new market rate survey and also the new narrow cost analysis to look at the true cost of care. So those subsidy rates might look at the cost of care overall. Now, I recognize that unless you had a classroom 100% full of subsidy children, that doesn't provide a solution to the issue, right? But it is some help.
Well, Nikki, thank you. I'm glad you chimed in. When I saw your hand, I was like, oh, I'm glad that you're going to speak to this because you can speak to it much more eloquently than me. I'm glad you talked about Simon's work and the cost of care work that we've been doing, because I think that harkens back to what I said earlier about we really have been working hard to understand what that cost of care is. And there's certainly some real efforts underway that, as you said, aren't a solution, but look to improve where we are. And I think we'll continue to look for other solutions as well. But yes, that work is terribly important. And thanks to Nikki, and well, thanks to all of you for who have provided significant information as we've gone through this exercise, the state agencies and the governance groups. We couldn't have done this work without your help. So thank you. Any other questions, observations? I know we're getting near the end of our time, but would love to hear if there's anything else. And if not so, I think I'm not mistaken that, yes, I have another slide. I did want to talk about next steps, and that is, we've gathered most of the information that we think we are going to synthesize and integrate into the report, but we want to continue to present these findings and to talk with groups, including the state directors. Next week at the All In for Kansas Kids webinar, we'll be giving a presentation very similar to today's discussion. And we hope to be able to refine from that feedback and discussion, our findings and suggestions. The goal is to present a final report or a penultimate report to the Children's Cabinet for endorsement on December 1st. So by the end of the year, we hope to have a published 2023 needs assessment, which will be informing the development of the next strategic plan, and look forward to being part of that work and look forward to our ongoing discussions. So thanks again for the opportunity to be here today, and thank you all for the tremendous amount of work you do to advance the well-being of Kansas children and our families.
Very good. Well, thank you, Chris. It's been amazing to be able to look at all we've done in Kansas, since we started, we rolled out our needs assessment and our strategic plan or whatnot. And we know that, your team did an amazing job in terms of gathering data and analyzing data and really helping to shape and guide the direction of where we need to go. And so thank you for all of the work that you've done. And hats off to everyone in Kansas who has kind of stepped up and said, okay, we've identified needs, now let's come up with plans and things to do. What I've definitely seen in this is, as you can look at the data, is, we have seen improvement, and we have seen not that this is just something that sits on the shelf, as you say, but it's something that actually comes to life, and we use it to help develop plans to better support children and families. And we have our state agencies that are all working together, for the common good. And that is, also been very refreshing. And so, great things ahead. And we look forward to supporting continued efforts as we come up with and develop a different strategic plan, perhaps an enhanced, the strategic plan +1 for Kansas, or whatnot. So thank you. Very good. Next, we have the update and review of the early childhood, early learning standards, the revisions or whatnot that were made by KSDE. And so we have Kim Kennedy and Natalie McLean, who will be giving us an overview of the changes, enhancements to our Kansas early learning standards. And I'm also looking forward to hearing from them on that. So take it away, please.
Good morning. I'm Kim Kennedy. I'm with the Department for Children and Families, and I'm the Head Start Collaboration Director. And I've been working with Natalie McLean and a core group of early childhood professionals across the state on some revisions work for the Kansas Early Learning Standards. Just to note, the center of the work of updating these standards have been around on making sure that the standards are developmentally appropriate and that best practices can be widely used with professionals working with children ages birth to kindergarten. And here you will see, here's the list of the early learning standards core team that participated in reviewing and revising the early learning standards. This team started their work in February of 2022 with a few focus areas in mind before diving into each of the content areas. You can go back to the next slide, please. There we go, or to the previous slide. So the three things that we looked at was looking at the current standards with a lens on where there maybe appeared to be standards that are missing. And then we looked at the standards with the lens of equity, diversity, and inclusion. And then lastly, the team took a look at the standards with the lens of usability for different audiences. So this would, include families, childcare professionals, and school districts. And then this work progressed through August of 2022, where the core team concluded that in those sections where it maybe appeared that standards were missing, it's really that they weren't missing, but that it was inappropriate to have a standard at certain age levels throughout some of the content areas. And so the team decided to create a graphic indicator that would just simply show that these skills were not yet developmentally appropriate. And then we took a look at a more intentional statement on equity, diversity, and inclusion. And we felt it was really necessary to not only have this statement in the beginning of the document, but throughout each of the content areas of the document as well, to remind users, again, of the importance and keeping equity, diversity, inclusion at the forefront of our work as we're working with children and families. And then we took a look at developing training and guidance for each of the audiences that will be using the standards, as well as using plain language in a way that would be most helpful to ensure that the updated standards are used widely. And then lastly, the group decided that the final document, that we'd have an online document that would include links to examples of what the standards would look like in practice, as well as strategies on how to help children meet the standards, and then to allow the standards themselves to be more user-friendly and help providers with appropriate practices. Next slide, please. So the early learning standards are things that we want children to know and to be able to do. And this position statement from the National Association of the Education of Young Children and the National Association of Early Childhood Specialists in the State Department of Education just reinforces the approach that we took to revising and updating the Kansas Early Learning Standards. And so this statement states that rather than relying on simplification of standards for older children, the content and desired outcomes of effective early learning standards are based on research about the processes, sequences, and long-term consequences of early learning development. And so that is the exact approach that we took as we looked at, what are those foundational skills and where do we need to start with building those skills in each content area. And next slide, please. And I will turn it over to Natalie now to bring you up to where we are currently at with the work of the standards.
Thanks, Kim. So I'm Natalie McLean with KSTE. So as we've moved along in this process, we finally got to a place where we were ready to jump into the content areas. So this graphic gives you an idea of what we worked on through the year. In August, the core team was ready to begin work on the content areas. For this part of the work, we gathered content area specialists to help with each area. So our content area specialists included experts from the field on the topic areas, including childcare providers, preschool teachers, Head Start teachers and directors. We had trainers, 2- and 4-year college representatives, and KSDE staff that specialize in each of the subject areas for the K through 12 subjects, just to name a few. Beginning in August, the first meeting of each month centered around a content area and involved the larger group that included the core group that we saw earlier, along with these content area specialists. These meetings were all held virtually. Groups reviewed the current standards and then worked to make edits. During the second meeting of the month, the core team met to discuss the discussions from the content area specialist meetings and then make final decisions on the revisions. As the team progressed through the standards, a consistent issue we found was there were quite a few standards that were the same or repeated across multiple age groups. For example, in the language standards, we have a standard that says uses frequently occurring nouns and verbs. It's listed both as a pre-4 and a kindergarten standard. So the team worked together to figure out where these best fit so that we weren't repeating these standards. We did not, however, change any of the kindergarten standards, as these are pulled directly from other existing standards from the K through 12 content areas. Next slide, please. So we'll go ahead and jump in. I know I sent you very last minute a draft of the updated standards. So now I'm going to just briefly go over things that have changed or that we updated in each of those content areas. So in August, the content specialist core team focused on the approaches to learning standards. Very minor updates were made to these standards, including simplifying some of the language and adding in the kindergarten standards for problem solving. So again, some of the language in these were a little bit unclear, or standards may not have made sense with the subheadings that they were under. So just a little bit of wordsmithing really helped to make these more clear. Next slide, please. In September, we tackled the physical health and development standards. Changes in this content area included changing the subset large motor to be called gross motor. We had some minor wordsmithing, and we added in the kindergarten nutrition content standards. We changed the personal hygiene section to be called self-care and adjusted some of the safety standards to make them more age appropriate. And we added in the kindergarten standards for injury prevention and safety. Next slide, please. Social emotional development was our topic for October. As you can see, this is the heart of our early learning standards. It has the most standards in it. This is the area we always hear from kindergarten teachers that if in early childhood we can work on these things, then they can handle the academics. And I think this really reflects the work that we do in early childhood. So changes in social emotional development included removing the subsection that was titled Play a Developmentally Appropriate Role in Classroom Management and School Governance. This section had standards that were represented in other sections of the document, as well as some that did not really make sense to the title of the subsection. The wording of some subsections were updated to reflect more direct language and overall made the section more meaningful and appropriate for our early childhood kiddos. In February, the team decided to add a section, and you'll see that at the very bottom, to this social emotional development subsection on social development. These standards were originally located in the social studies section of the standards, which has now been removed. We'll talk more about that later, but community and citizenship really seem to make sense under social development. Next slide, please. Communication and literacy skill development standards were the focus of the November meeting. This section was so closely aligned with our K through 12 standards that much of the document didn't really make sense for early childhood. The team made the document more appropriate for early childhood by putting standards in order of how young children learn. So we started with the speaking and listening standards, we moved to language, then literature, foundational skills, and then writing. We combined what was once literature and informational text into just one big section. For early childhood, most of these were just repeated in the second section, so it made more sense for us to combine them. The team also simplified the writing section into one section. Previously, it had several subsections under it. Now it's just one big section. Also, we updated the K through 12 literacy standards have been updated, so we added in those or made sure that those matched in the kindergarten section. Next slide, please. Thank you. December's meeting was focused on mathematical knowledge. Updates included adjusting some of the standards to make them more age appropriate. We had some minor wordsmithing, and we removed duplicate standards across age groups. An example of this in counting and cardinality section, we removed standard MCC P4 4C, which demonstrates an understanding that each successive number name refers to a quantity that is one larger. We removed that from the 4-year-old standards as it's also a kindergarten standard, and it really is more developmentally appropriate for our kindergartners. So there were a couple of those that we evened out there. Next slide. Science standards were tackled in January. The group noted that the math and science standards do tend to cross over in several cases. We rearranged some of the standards to group together those about weather. Some of the strand names were updated to more plain language. We also added the section that's very first on here, scientific inquiry, as this is the basis for not just scientific learning, but much of our early childhood learning in general. They go through that scientific inquiry process. Next slide. So here we have social studies. In February, the group reviewed the social studies standards, and we found that in most of these standards, they were already covered in other content areas. A lot of them were either in science or in social emotional standards. Some of them were not developmentally appropriate, and we also found that many of other states do not even have early childhood standards for social studies. The group decided to remove inappropriate standards and those that were repeated from other sections. There were several related to weather that were moved to the science standards. And then there were several that were already existing in social emotional standards that I mentioned before. This left just a small group of standards that all had to do with the topic of citizenship. This section was added to the social emotional development standards under the interpersonal skills heading. We were then able to delete this section and make our document a little more precise. Next slide. Creative arts was our last content area. We covered this in March. Originally, the creative arts standards were broken down. We have these 4 topics, and then there was 4 subheadings under each of these. We just combined those, so we just had 4 different headings. Not all of these were developmentally appropriate, and many of the 0 to 3 standards were repeated from other sections. A lot of them had to do with movement or with literacy and speaking. So the group renamed the acting and theater heading to a more early childhood appropriate dramatic play, and did some little wordsmithing, and ended up with our 4 final creative arts subheadings. Next page. So moving forward, after we edited each of the content areas, we circled back to the beginning of the document just to update the information we had in the beginning, and did some work to make sure that the information was useful and relevant, and led early childhood professionals to do what's best for all of our early learners. We have a few busy months ahead of us. We're going to be presenting to several large groups from across our early childhood system and asking for feedback. We're going to be seeking public comment on the KSDE website, and then we'll be requesting approval from the KSDE Board of Education as well as the Children's Cabinet. Next slide. We do have continuing work going on. What we just shared is mostly the content of the document, but we do have other things that we have to work on still. The KSDE Graphics and Communications team is currently working on getting the updated standards into print. A major change will be the way that this document looks visually. The draft that I gave you is very similar to what we have currently. It's going to change in order to make the document accessible to all users. Our tables and our bullets are going to have to be kept to a minimum, and most of our document is tables and bullets. So we'll see what that looks like after our graphics team gets a hold of it and makes it more appropriate for all users. We are planning on using the All In for Kansas Kids graphic design to reinforce this is a statewide resource. This is not just a KSDE resource. It's not just a DCF resource. We're using this statewide for all of our early childhood providers. So as soon as we have a printed document, our dissemination process will need to happen. We hope to get this sent out to licensed childcare providers, to our Head Start programs in school districts with pre-K programs. So that'll be a big process to get this printed piece of work out to everyone. We are also working on a website that'll include resources to accompany our standards. We're going to be setting up a website to house the KELs along with the resources to accompany them, things like activities to help build skills for those standards that are not yet age appropriate, as well as ways to adapt activities for children with differing needs. We're also going to be needing to develop training for our different users. Next slide. So we did a whole lot of talking, and we'd really like to open up to all of you. I know you didn't have a lot of time to look at that draft. I will remind you, it is still very much a draft. The content, I think, is mostly there, but we would still invite you to share any comments or feedbacks that you have by raising your hand and sharing with us.
Alrighty, so thank you, Natalie, first off, but thank you both for the update and information. I'm looking forward to kind of diving in and reading everything and seeing how we can incorporate all of this into our work that we do. So first question that I saw raised, is it Jatis?
Yes, it is. I just want to say, as a new preschool teacher who spent a lot of time, especially at the end of last year, going through all of those standards and everything, making sure I did what I was supposed to do, it looks so much better and it's more concise, and that wording, you know, you guys did a really good job of, you know, taking some of that stuff where when you're going through it as a teacher, you're like, you want me to do what? And making that make a lot more sense. So that way you can make sure that you are doing what you're supposed to be doing for your kids. You know, by the end of the year, are they where they're supposed to be? So thank you very much. It looks so great.
Thank you.
Kelly?
Hi, Kelly France Langford. I also appreciate the fact that we're really looking at early childhood education as provided in many different formats across the state, from birth through kindergarten. Just a couple quick comments. There is one wonderful graphic in there about inclusive practices for preschoolers. I'm just wondering if something similar could be created along those same lines for inclusive practices from birth through kindergarten. Another comment would be, as you look through the standards, I'm wondering if there is room to include children who might you know, do some of the same things differently. So for example, under the standards where it says speaks, maybe it's communicates for children who use AAC devices well and can learn to communicate their thoughts and ideas. It just might not be through verbal speech. And then my last one isn't so much a comment, but just a question. I was wondering if you, or if this is the place where you would go into a little bit more detail on the distinction between literature and foundational skills. But I don't know if this is the place to do that, or maybe if there's another format that would be better.
Sure, so that might be a good thing for us to add in the key terms, maybe. Do you think that would be helpful?
Yeah, I think whatever, you know, I'm thinking sort of in the terms of all providers and how foundational skills impact literacy and why those would be like the purpose in pulling those out, or sort of, I'm just trying to think as far as usability.
That's helpful feedback. Thank you, Kelly.
Amy?
Oh, you're still muted, Amy.
Thought I
There it
hit
goes.
that. Sorry, Amy Gotchammer. I just wanted to say thank you, and I appreciate all your hard work. And I really wanted to make a shout out for the kindergarten transition section, and that you added the work of the panel related to the kindergarten transitions toolkit. So thank you so much. I caught that and I was very excited.
Very good. Any other questions? Okay, if none, then soon we will have the draft of the KELS, as I understand, posted online, and people will be able to provide review and comment or whatnot that way as well, correct?
Yes. So public comment will be available in October. It'll be on our KSDE website. I will share this information with the panel as soon as it's set up. It will, like I said, open in October. I also wanted to just give one big shout out to everyone who's helped with this. I feel like Kim and I are the mouthpiece here, but there's a huge team that's been working really hard on this, and I want to be sure they all get credit for that too. Oh, Leanne.
One quick question. What's your goal for timeline in terms of implementation? Would that be the next school year?
Yeah, I think a reasonable timeline would be the what year is it? 24. That sounds crazy. 24-25 school year. Yeah. We definitely would want to get this, it depends on how long it takes to disseminate all of the materials to everyone. But yeah, I think 24-25, 25-26, because we're going to need time for training in there too. But, I hope that spring, summer, hopefully people have these in their hands or are accessing it on the website. When that still has to be built, so that's not even done yet. So that's my guess, is 24-25 school year, or maybe the following, just depending on when we get things out. Can we flip the slide one more? If anyone thinks of any other comments or feedback that they'd like to share, you're certainly welcome to share that with Kim or I. Here's our emails that you can reach us, or phone numbers, whatever's easy for you guys. We appreciate your feedback. And again, like I said, we will be posting this for public comment, and I will share that with you after we get that set up. Does anyone else have any other comments or questions on early learning standard revision? Thank you guys for your time and feedback. I really appreciate it.
Well, again, Kim and Ellie, thank you both for presenting, and looking forward to being able to share the link or whatnot with our staff, just to have teachers give feedback and comment or whatnot. And so that's exciting. So looking forward to this being launched. Okay, next we are going to hear from our work groups. Each of our work groups had their first meetings after our last panel meeting, but then also some had additional meetings afterwards. And so we'd like to just get an update from each of our work groups. And so first we're going to hear from Tactics 615, which is recruitment and retention.
Sorry, I was expecting to go in a different order. Sorry, this is Amy Gottschammer. So we, I admit I'm just reading off of notes because I was unable to attend last month. But basically, the group went over the recommendations and comments that came back from CPPR and the cabinet, and just kind of reviewed their comments and then had additional questions to go with it. But what I think we're looking at mostly now is the purpose of the guide, of course, was to look at the challenges and address those for childcare recruitment and retention. So the original idea was that this was a guide to sort of help people navigate those challenges, say, what is my particular challenge? What are some of the ways I might solve this problem? But some of the questions that came back from CPPR and the cabinet were things, valid questions like, who is your audience, things like that. So kind of, I think, looking for us to maybe narrow our work a little bit, get a little bit more fine tuned. Are we focusing on systemic issues, or are we targeting the providers or other professionals, and just kind of see how we can, fine tune this enough that we can get measurable impact and see what does this end up being. So I think we just need to take those questions and do some more review here today at our meeting, and answer some of those questions so that we can provide a document that will be a useful tool, maybe, like say a guide or something akin to the kindergarten transition toolkit, perhaps something like that in the end. But that's kind of where we're looking right now, is how do we focus our work and determine who we're addressing. So I think that's it. Anybody that was there have anything to add?
Okay, great. Questions, comments,
Questions?
feedback? Pardon?
Sorry, I just said questions.
Okay, if none, if we can have a representative from strategy 4.2 regarding family-friendly workplaces.
Hi, this is Melissa Martin with the group. Like the previous group, we also were really working more deeply into the feedback that we received from the cabinet. And in our case, a lot of the feedback centered around more specificity to the recommendations that we had made. So we started work on that. We identified some agencies that are already doing some of the family-friendly work. And we did decide that one position that we take is that promoting family-friendly work through our various state departments is pretty critical. And so we believe that, you know, commerce and labor are natural places to have family-friendly practices and policies promoted, but we felt that having every all of these departments put these into practice, put information about how they're doing that and resources on their individual websites would be very helpful. We also strongly believe that a marketing campaign has to accompany these efforts. And so we arrived at 2 more specific recommendations, and the first one is not yet complete. The first one is to activate the Children's Cabinet to recommend integration of family-friendly practices into all of the departments of our various state departments. And then resources for these practices include the work of Kansas Power of the Positive. And then we want to also add a couple of other resources to that recommendation. The second recommendation at which we arrived was to activate the Children's Cabinet to conduct a statewide marketing campaign that promotes family-friendly practices to employers. You know, we have been firmly of the opinion that you know, really getting employers to embrace this, whether through awareness or incentive or kind of the employee pressure for these kinds of policies and practices is what has to happen. So in our next meeting, we will continue to drill down into the questions and comments that were provided to us. And again, just continue providing the responses we need to and providing further recommendations. Anybody else in our group want to add anything? I know we have a couple of people missing today. Okay, sounds like that's it for us. Questions from anyone else? Okay.
Okay, that's great. So if none, may I have a spokesperson for group 611 regarding compensation and benefits?
Morning, this is Heather Schroberger. This group, like the other 2 I've already mentioned, also have taken the feedback received to determine next steps. And so continuing to build on the work that the group had done last year and focus on refining a definition of competitive compensation and benefits for Kansas early childhood care and educational professionals. So to do that, we've been working on mapping out all the elements of a compensation and benefits system to be sure that we have identified them all and that the elements we have identified fit within that realm. And so we're going to focus our work today and in the coming month on finalizing that. And then from there, we're planning to look at really what are the potential opportunities or leverage points within that system so that we can develop and prioritize a few concrete recommendations regarding compensation and benefits for this field. So we'll look forward to sharing more of that out as we get more specific with that. Anyone else from this group want to add anything to that? Okay, or any questions from any other panel members? Okay, thank you.
Thank you, Heather. And may I have a spokesperson for group 612 regarding local zoning and homeowner associations?
Hi, I'm Christy Wyckoff, and I am going to report. Can you hear me? Sorry, my picture wasn't green around it, so I wasn't for sure if you guys can hear me. And I'm going to report on behalf of our group. We had a good work session earlier this week, reviewing the feedback that we got from Melissa and CPPR, and our new team members is part of the Go team, and they have drafted a toolkit that's in draft format right now that we think would be a really good first recommendation. And so we are going to try to elevate that toolkit. That would be our recommendation. So we're still formulating our recommendation, but that is what we have at this point. And then we will carry on the work of the homeowners association later into the year, and then a few more recommendations after we can go through a little bit more in depth into her review of our June presentation. And so that's where we're at right now. I also have a meeting with Melissa later this month to kind of hopefully finalize this first recommendation on behalf of our group to the cabinet, and hopefully we get a lot of good work done then and can have a finalized recommendation. So that's all I have. If there's anybody else in our group that wants to share that I forgot, or if there's any questions, I'll do my best to answer.
This is Emily Barnes. I want to say there's not anything that I think needs to be added to that. I think Christy did a great job of summarizing what we did. I wanted to say I really appreciated the feedback that we were given, and then based on what I'm hearing from the other work groups, I'm actually really appreciating the way that we're doing this process, because I know that in the meeting we had the other day this week, that feedback forced us to really get specific and think, and I think that what that's doing is really helping us come to a very solid idea. And so I just at least wanted to give feedback to the whole group that I really do appreciate, the fact that, Melissa was very thoughtful and kind of almost challenging in some of the comments. And I really liked the conversation we were able to have as a result of that. So thank you.
Well, Emily, I appreciate that. And the cabinet is available. Melissa is available to give feedback at any point. So as you are kind of looking at different recommendations or whatnot, if you just kind of want to put something out there for her consideration or whatnot, comment. She is open and available for that. So if in fact you get to a place where you want additional feedback, are we going in the right direction? We can certainly present things to her to get that feedback, because you're right, it is helpful, because then we know that we're going in the direction that she wants, and she does challenge our questions and makes you kind of think about things in a different way. But that's helpful because we want to be able to craft recommendations that we think the panel will approve, and that can do good for everybody. So thank you for mentioning that. And again, Melissa is available should you want to receive feedback at any point. So thank you all for the updates. I'm looking forward to hearing continued work from each one of the work groups. Next, we have bright spots. And so panel members, you are invited to share any bright spots happening within your organization or your community. So does anybody have bright spots to share? Emily?
I'm going to take just a minute to brag on myself. I was selected as Exchange Press's one of their leadership initiative recipients, and the magazine came out. The fall edition just came out, and so I just wanted to take a minute, and none of the advocacy that I've done in the last 3 years would have been possible without this group and providers from the state. So it's a bright spot for me that that this nomination happens and I was able to.
Very good. Congratulations. Very much so. Congratulations. Good job. Anybody else? Other bright spots? Eldana?
I can want to shout out a collaboration that's in effect in Johnson County, and the fact that we're working with the Women's Business Center, and they are going to be putting on two town halls with the target audience being chambers of commerce and businesses, to try to educate them being chambers of commerce and businesses, on the importance of early care and what they can do to help childcare providers across our county, as well as parents, that are their employees, because it's been said before, if the businesses helps the employee, that helps the childcare community overall. So I'm just really excited to have that partnership in place.
Very good. Any other bright spots? Okay, so if none, I'd like to give a reminder that all of our agenda items for panel members are on the panel SharePoint hub. Lindsay did send the link out to everyone that can give you all of the agenda and resources, et cetera, that are mentioned during our meetings. Our next meeting for the Children's Cabinet and Trust Fund is going to be October 6th from 9 to noon. And our next Early Childhood Recommendations panel meeting will be October 20th at 9 o'clock. The Children's Cabinet and Trust Fund meeting will be live streamed on YouTube, as will our recommendations panel. So we are going to take a 10-minute break so that people can stretch, get some more coffee, et cetera, and then you will break out into your work groups. And so it is 10:37. We're just going to call it 10:40, and we will meet at 10:50. So Lindsay will send links out for your work groups. But again, thank you all for joining us this meeting. Thank you for the feedback. We got a lot of information this morning, a lot of good information and great discussions. And so I thank you for everyone that presented and shared information. And thank you for everyone who's been watching the live stream. So we will see you all soon, and have a great weekend.